Can bring you some breaking news here on All Out Politics. Public Health England has detected samples of the Kent variant with mutations that may help it evade the immune system. Well, we can get more now from our science correspondent, Thomas Moore. Thomas, thank you for joining us. A lot of talk about variants, but this is basically the Kent variant becoming like the South African variant, is it?
Exactly that. In effect, it's developed a superpower, Adam. But this is a mutation in the South African variant that seems to not only help it infect cells, but also to evade the immune system. The reason being that the spike protein that all the COVID viruses use to latch onto human cells changes shape. And that means that the antibodies don't recognize it in quite the same way. And the fact that this mutation is called E484K has now been picked up in some samples of the Kent variant would be a twist, a worrying development, because it potentially means that people who have had the infection before might be reinfected, and also that it would reduce the effectiveness of the COVID vaccines. Not knock them out completely. Certainly the tests done so far suggest that the vaccines would still protect against serious infection and death, but perhaps they wouldn't stop the virus spreading. And that would mean that people who couldn't have the vaccine or didn't want the vaccine, that they would still be vulnerable to infection. Now, I have to say it's just 11 samples out of something like 200,000 that have been sequenced. But the fact that it has been detected through random sampling suggests that there are more out there. And it's ever more reason to try and stop this virus spreading further, to reduce the overall infection rate, because if you do that, it reduces all viruses, all variants, and it also reduces the chances of new mutations occurring.
And Thomas, how does this information relate to the current test and trace campaign concentrated in certain areas to get a handle on the South African variant?
Well, certainly that was done because it had been detected that 11 cases with no travel history whatsoever had been detected here in the UK, strongly suggesting that the virus had begun to spread within communities. That's a worrying development, again, for the same reason, that this 484K mutation does mean that the virus would be less sensitive to the vaccines. Now, the hope is that because they've detected the very early sparks, they believe, of this outbreak, that they can snuff it out at an early stage through rigorous test and trace, convincing people to isolate. And we know that that's not always successful, but it's going to need to be done in this case somehow, even if that's through some financial means. It is going to need to just try and stop this mutation spreading, because it gives the virus such an advantage. It's likely that it would potentially become the dominant strain quite quickly.